platform that is used to transmit, capture, receive, and store multimedia data for the purpose of providing healthcare and healthcare-related services. This includes any information relating to past, present, future, physical, mental health. Health Information Exchange, HIE. Health Information Exchange is the mobilization of healthcare information electronically across organizations within a region's community or hospital system. Benefits of HIE and EHR. HIE improves patient safety and efficiency, and EHR improves quality and convenience, increases patient involvement also in their healthcare. How will it change the clinical setting? EHR will definitely change the setting that a patient becomes a part of when entering the clinical facility. Tablets. Many patients will notice a major difference in how doctors may be seen using tablets during the visit. This allows the doctors to allow the patient quicker visits, improves their operation, and increases automation. Safer practice. It will be good for the patients to be aware of how HR can make the patient's information safer. It can save from data errors being introduced and also allow the doctors to create seamless documents. Quicker and more complete visits. By using EHR, the doctor will be able to work much faster. Not only this, but through EHR, the doctors will be able to have a more timely response to the patient's problem and hopefully be able to conclude the diagnosis and possible remedies. Patients' benefits due to electronic health records. Patients benefits with electronic prescriptions, and the patients will benefit with continuous of care. Electronic prescriptions. It will be faster and more secure. Patients benefits from improved efficiency and service as a result of electronic medical record system. Prescriptions are electronically sent directly to the pharmacy and are ready to be picked up after the office visit, which will reduce in prescription errors, and drug interactions that have already been demonstrated in clinics from the use of technology. E-prescribing offers clinics a powerful tool in safety and efficiency compared to paper. The functions of a quality e-prescribing system. A qualified e-prescribing system must be capable of performing all of the following functions: generating a complete active medication list incorporating electronic data received from applicable drug plans if available, review patients' current med lists and medication histories within the practice, prescribe or add new medication, and also select the pharmacy where the prescription will be filled. This information has to be sent to a trans hub. Benefits with continuous of care. When the patient's paper medical record is converted to electronic format, the patient and his or her medical team will have a number of immediate benefits. The record will be secure, legible, and available to all members of the physician's staff. It can be accessed by the physician from home, emergency room, the hospital, and nursing home, or from anywhere in the world. Automatic reminders from a variety of preventative care are easily generated also. The physician now can quickly pull up past medical records, lab results, and even radiology reports while in the exam room with the patient. Continuous of care with EMR benefits. It can be shared across all practices and settings, which can help patients when they're out of town. Also provide care and exchange information for emergency care. This helps if a patient is in need of more advanced care. Referrals and consultations are more organized, so the patient can have record of the information if needed. The patient will no longer have to search through piles of paper notes to help with the patient's treatment. Also, due to the faster pace of the EHR, patients' appointments will be more meaningful and more efficient. Patient portal application that allows patients to interact and communicate with their healthcare providers from the comforts of their own home. All you need is a login name, password to the physician or hospital's website. Once you have signed up for the account, you'll have 24/7 access to your convenient online services. Why should you use the patient portal? It saves time. The patient portal can save you time by using your own home computer to communicate with staff at the doctor's office from the comforts of your own home. According to the EHR system, all scripts, 72% of patients would like to connect with their physicians online. All the perks of the portal: request appointments, request refills on prescriptions, receive labs and other clinical test results, send questions directly to your provider, and ask billing questions. Doctors' offices are being so busy today seeing patients who have an appointment, it's sometimes hard to handle all the walk-ins, phone calls, and the patients. The portals let them respond to the patients at a more convenient time during the day. Before the patient portal, most patients would have to drive to the physician's office to pick up prescriptions, get lab results, clinical results, and sometimes even ask billing questions. Yet with the patient's portal, all the patient has to do is request refills. Next, if the doctor approves it, then it's e-prescribed to the pharmacy, like we had said earlier in our PowerPoint. Whereas the patient would then have to pick it up at the office. So instead of having to go all the way to the office to pick up the prescription and then go to the pharmacy, which sometimes can be a waste of time for the patient and also the doctor, this allows the patients to request appointments and prescriptions at conveniency for them. The portal is so easy. Here's just an example of what it is to sign up. All it takes: your first name, last name, date of birth, zip code, and email address. You would click continue then, and you would go to another screen where you'd have to type in your password that the office would send you once you have inputted your email into their system. This here is just a picture of how our login looks like at work for me. We use all scripts, and as you can see over here, to your left, you have my messages, my patient page, appointments requests, prescription refills, help forms, and help forms could be anything from prior authorization requests for prescriptions, it could be FMLA paperwork, insurance paperwork, just different things like that. And also it has the conveniency of pay my bill online. So you can go in there, see how much you owe, make your payment, or even go in there and pay it off, or send questions if you don't understand about it. So, why not sign up for it? It's easy to sign up, and it's free. The steps are simple, and all you got to do is have an email address to access the patient portal. What more do you want to be able to communicate with your doctor, physician, or hospital at a more convenient way from the comforts